Good morning. We're here today to recognize Captain Scott Burguier, firefighter Rusty Robinson, firefighter Annie McCoach, firefighter paramedic Tyler Kime, firefighter Matthew Lyon, firefighter Shane Wigmore, firefighter paramedic David Denenberg, firefighter Giovanni Lopez, and firefighter Juan Carlos Gaugen. On Monday, January 13, 2020, paramedic engine 723 was dispatched to a residence in Rockville for a DOA patient. Upon the arrival of paramedic engine 723, the crew found a patient lying in bed, and they confirmed that she had passed away. The crew remained on scene with the patient's husband and awaited the arrival of the Montgomery County Police. While talking to the patient's husband, he mentioned that he was concerned about his son who was at the house. The patient's husband described his son as acting a little off recently and asked the crew to check on him. The patient's husband took the crew to his son's room where he was sleeping. The crew was able to wake the son and began to assess him and offered to take his vitals. The crew determined that the patient's vitals were stable. The patient denied any complaints, but due to the concern of the father, they were able to convince him to be transported to the hospital for further evaluation. Paramedic engine 723 contacted ECC and asked for a BLS transport unit. Ambulance 725 Bravo arrived on the scene to provide transport to the hospital. The patient was placed on the cot. As the crew was moving the patient towards the unit, the patient suddenly became unresponsive. The crew of the ambulance alerted the crew of the paramedic engine of the deterioration in the patient's condition. Fire paramedic Kime assessed the patient and found him to have agonal breathing with no palpable pulses present. High-performance CPR was initiated and a second ALS resource was requested to the scene. The patient was placed on a cardiac monitor and his initial rhythm was PEA. Crews worked together and a nasopharyngeal airway was placed. Ventilations were assisted by a bag valve mask and a CO level was assessed on the patient. CO reading on the RAD 57 was 11%, and a crew member from paramedic engine 723 went back into the residence with gas meters to check for any hazards. Approximately 5 minutes after the patient arrested, he had a return of spontaneous circulation with strong carotid pulses present. A 12 lead was performed, and the patient was in a sinus rhythm with ST depression noted. En route to Suburban Hospital, firefighter paramedic Kime and paramedic student firefighter Wigmore were able to obtain IV access and consult with the hospital. During transport, the patient began to vomit and he opened his eyes. The patient attempted to pull out his airway, so the crew administered Versed to keep the patient calm and help maintain control. The crew was able to suction the patient's airway and monitor his condition for any changes. While still en route to the hospital, the patient again went into cardiac arrest. High-performance CPR was once again initiated, and the paramedics administered 2 doses of epi and established an advanced airway. Upon arrival at Suburban Hospital, the patient again had palpable pulses present. Patient care was transferred to the ED staff. Every day, crews from Montgomery County Fire Rescue Service respond to calls from help and often face very dynamic situations. On this call, the crew of paramedic engine 723 demonstrated compassion in a very difficult scenario and took the time to address the concerns of a family member. The professionalism of the crew possibly prevented a second tragedy to strike the family on this day. Thanks to the teamwork, knowledge, and skills of all crews on the scene, the patient was given every opportunity of survival. That's a really